Get started. And my question for the day is, how did you labor? During labor and delivery, what was your best position? And did you plan to do it, or did you know anything about it, or it just happened that your body was leading you to that position? All right. So here at Mamatoto, we give you facts. All right. There are so many opinions. There are so many myths that we try to demystify and opinions, all right? But what we try to give mothers and families are facts that are scientific and evidence-based. My name is Rosemary Shikari from Mamatoto Childbirth and Breastfeeding Services. Thank you. So we can get started. I hope you can hear me. Give me a like. If you can hear me, give me a like, so that you can get started. So today we are going to talk about 3 labor position. We have the squats, we have the sitting, and the squats. No, today I'm not talking about standing or lying. It's just going to talk about the squat, the knee position, and the sitting position. All right. So the advantage of having a variation, it's because when labor begins, I see a like, I see 2 likes, that means I'm audible enough. Thank you. So during labor, I want us to understand how the baby comes, This is a dummy for my pelvis, this pelvis here, like that. So we have this bone here. We used to call it a coxibone, and it can be really curved to some people, and some people it's not as much curved. So this is the a dummy of a pelvis. And most children, today we are talking about a baby who is presenting head down, kichwa chini, all right, the normal, the majority way. So baby usually presents like this, okay. Some babies will just come with the head, but it will be facing in front, facing mommy's tummy. This, we call it posterior. All right. So yes, we're going to talk about what will happen to help your baby, all right, during labor, to come down as fast. All right, come down as fast. And what can you as a mother do to create more space? Remember, this is our pelvis. We want to create more space here, because pelvic is usually like that shape, very nice and all, but we want to create more space for our baby. And this is good if we do this during pregnancy. Let's not wait for the labor and then we start doing gymnastics. No. The best thing is to start during pregnancy. We start these exercises. They'll even ease the pain at the back. And I know around here we have that pain that you feel like you're, we call them the way they are. You feel like the vagina or it's swollen and it's heavy, and like your baby is dropping any minute. These exercises that we are going to talk about today will help ease that pain. All right. Can you see how I'm seated? With my legs crossed, I've created and I've tried to widen my pelvic space. So for pregnant mothers, this is a very good sitting position. So you've got your first sitting position, okay? Second sitting position is by use of a chair. You can use a chair or you can use a bathing ball, all right? If you have a bathing ball, you can use a bathing ball. Open your legs as wide. If you don't feel comfortable, don't worry. For me, I'm so used to do this. So you can just arc on somewhere that you feel comfortable and probably just bounce on the ball. This exercise is very good anytime from 30 weeks and above. At 30 weeks, you can start sitting and rolling on the ball, and this is one of the very good exercise that is used even during labor. It helps open. Remember, we're just opening. For anything that I do, just visualize this pelvis that is opening. For anything that I'm doing, it's opening. When you do this this exercise like all the time, by the time your baby is ready to come, your bones will be like very much flexible. You know, just visualize that time when you wanted to remove the teeth. We keep kutingiza meno, you know, until eventually the teeth is or the tooth is well loose, you know. So that is what we are doing to our muscles. We want our muscle, our pelvic muscle, to have lots of exercise, such that by the end of 9 months, by the end of 37, 38, 39, 40 weeks, our pelvic muscles are very relaxed and well lubricated, right? So you can use a ball. You can purchase a ball. You can talk to Mamatoto to give you a ball for some time. The second sitting position, we have a dining table or two. So you can use this position and sit. Alright? This sitting position is very good. Alright? Because what's happening to my pelvis, my pelvic muscles are wide like that. Okay? So that one becomes our third sitting position. It's a very nice position that helps mothers during labor and during pregnancy itself. It widens, okay? Those at least are 3. And if you can get, so moms at home, where at your own comfort, at your own toilet, I know you have these seats that are the toilet seats. Is it called toilet seats? Yes, where we usually go and sit like this. Try to use the opposite direction so that you face the WC, just like I had sat on this chair, such that because when you sit on the opposite, you'll be able to open your legs nicely and your muscles will be flexible, ready for your baby. Right? So look at this position. How cool is this? How cool is this? You know, sometimes moms ask me, like when those people who are in Ushago, how comes they do not have a lot of birth complications or they don't labor for long? And I'm like, as the town people, we just have a lot of problems. Huh? Number one is even the toilets. You see, this is a squatting position that we use when we use the latrines. Okay, back when we shall go, or those who have the latrine toilet, they are advantaged. One, throughout, at least minimum 5 times a day. When you visit the latrine, you'll sit at this or using this position. It creates the same. It widens the pelvic muscles. It helps lubricate, because every time you're up, you will do what? You will squat. Okay? This is also a very, very good one, position during pregnancy, 2, position during labor, and 3, position during pushing out your baby, because it's all the force of gravity. I know some facilities have bathing tools. At Mamatoto as well, we have a bathing stool where you can just sit, and then the midwife will just come and kneel right in front of you, and you'll be able to receive your baby comfortably in that position. So this is a very good position that definitely will work for those 3 scenarios. All right, so that is squatting, and I am done with the squatting and sitting positions. So let's discuss the next is kneeling. All right, still in my position at home, I can still kneel. All right, can you see me? This is just a good kneeling position. You can, the best thing to remember is we want to open these 2 bones. We want to widen them up. So at any given time, even when you are kneeling down, just make sure your 2 legs are wide apart. All right? So I don't know if it's the best way to take it. Let me take it this way and then I'll turn. Okay? This is 1. So when you're like that, that's a kneeling position. I hope you can see my thighs wide apart, and definitely our big, nice, beautiful tummies are right here. All right, so You can swing. Just slowly take your time and listen to your body. If you're not comfortable to do this, call Mamatoto, call your doula. We are going to assist you do this until you have the confidence that it takes. Because remember, you have your tummy and you might lose balance. If you are not comfortable, please don't do it. Let me take it also from this side. Legs apart and then up, down. Slowly listening to your body. If your body says stop, please stop. That is the first kneeling position. All right, the second kneeling position, you can use your ball. All right, you can use your ball to do the same. I'm kneeling. All right, my beautiful tummy big, baby is very well secured. And you can as well swing, swing, swing. All right, if you do not have a ball, you can use a chair. At home we have our chairs, right? So you can just lean on the chair, spread your legs, same thing, down, up, down, up. All this we are doing this. Oh, hi. Yes, Maureen, thank you. Leah, thank you. Maureen, yes, keep tagging them for me. Thank you. So just remember that at all times when you are doing these exercises, one, very ultimate number one, talk to your doctor, talk to your gynae, because some pregnancies have a few complications here and there. Some of us have bed rest, strict bed rest from the beginning to the end. Some of us we get better and we are free to do it. But however way, it's very good before you start the exercises, kindly talk to your gynae to advise you, and then get hold of a childbirth educator or get hold of a doula. We are gonna support you and we'll show you the right thing that is tailor-made for you. What I'm giving is just general for every mom, but some of us have those special cases that we really understand. Remy, thank you for watching. Akinya, asante sana. So we are still on kneeling position. The other kneeling position is using our pillow. All right, so this one we are going a little bit lower, you know, a little bit lower, because we are not using the ball, we are not using the chair, so it's about the pillow. Here we go. Please look at my back. I want you to see how my back will arc. When my back arcs, what happens before I do that? What happens to my back? This is the back. So what happens to my back when I go low? It curves like that, and this coccyx, you can see the coccyx, it creates space. Can you see that space? So I'm like this. So when you go down, it opens and creates this space for your baby, so your baby can rotate. All right, your baby can come down. Are you getting that? So that is why knee chest position is usually recommended when you hear your midwives or your gynae saying the head is high up, or they tell you mami umefunguka lakini kichwa ya mtoto iko huko juu. Yeah, juu is this juu, juu is that juu. All right, okay. And then, or your baby is on posterior, is coming the posterior presentation. So that means when you do this exercise, the knee chest exercise, you remember the coccyx opens and you create space. So how you doing it? Legs apart as usual, calm down and open. All right, if you can see, oh, I'm trying to create like a letter A between my upper body and my thighs. There is a nice curve. All right, because what we want to do with this exercise is to open the pelvis. You know, when we've opened our pelvis and when everything is adequate enough, the secret is we will not stay in labor room for long. That's the best thing about it. We're not gonna stay in the labor room for long. Remy, oh, don't worry, Mama. We are here, and we pass you a lot of love. There is Josephine learning so much. Thank you. So I'm still taking questions, and that probably brings us to the end of the laboring position. All right. So all whatever we've said about, and the ones that I have demonstrated, it's 3. So tomorrow or the other day we'll do the standing position. What can you do when you're standing? What exercise can you do apart from walking around that we commonly know, and we are sometimes we pant, you know? What else? And the other one is sorry, is the lying position. Actually, lying is, we prefer when mothers lie on their left. All right, we prefer when mothers are lying on their left. But how? You've lied on your left. So what else can you do when you're lying? Sometimes it's because you have a condition. For example, you're hypertensive, or for some reasons you have some medication that is running, and you're forced to lie throughout labor for whatever reasons. So what can you do to ease all that duration when you are lying down? So that will be the discussion for next time. And definitely, what else can you do apart from standing up? All right. Leah says my symphysis pubis hurts. All right. So sorry, Leah, about that. I'm smiling because of the typical words that I usually don't like mentioning, but I'll have to mention anyway. So when she talks about her symphysis, it's this bone. This is our pelvis, remember, here, and the baby is lying. This baby of ours does not want to go back inside. Okay, so this, you see around here, and if we touch around here, it's this carbon that we usually feel here, right? That is what Leah is saying, that is a bit painful. I'll talk to Leah later and ask her so many other questions, but in a nutshell, the knee chest position that I've given works very well. Then at times it's good to lift your belly. If your belly is really lying on this, you can lift it up a little like this, walk around, and then release it. All right, lift your belly. You are just providing the pressure, you are releasing the pressure that the baby is causing on your symphysis. So just hold your belly nice and slow, push it up, walk around, and then release the belly. Then try as much as you can to do the knee chest positioning, and let me know how it goes. But you can call me so that you can talk about it. Remy, I have a friend, but mtoto aliambiwa hajatan bado, ako 35 weeks. Remy, yeah, that can be demoralizing, and it can affect a mom, because now I am so sure her mind is tuned to, really tuned to, I'm gonna have a CS, you know. At 35, this baby here at 35 weeks is a little bit a big baby that may not have a lot of space to maneuver around your uterus, because the baby is a real big baby. So there's some exercise that we can recommend and we can teach, but they are not guaranteed that they are going to turn the baby. And this will makes me remember that do not allow people to massage your stomach, you know, that they want to turn your baby, because a lot of things are happening in this uterus. So imagine your baby is at breech. Breech means this, huh? Breech means baby is coming with the butt, huh? So your baby is like this. And there are some moms who believe in going to the traditional birth attendants or something, the nyamreras, where if you're in Luo Nyanza, who are able to turn your baby. Kindly remember, your baby has an umbilical cord that is feeding the baby, and this can can choke the baby, can, you know, tie around the baby's neck. And so just follow your guidance instructions, the ultrasound and everything. The exercises that we recommend are more or less of whatever we was talking about. They may or may work or may not work, and mostly depending with how big the baby is. All right, Remy, but you can still call me for more. We are done with today's discussion. Let us know what you want us to talk about tomorrow. Today we were supposed to talk about sibling rivalry, why your firstborn fights with your secondborn, thirdborn fights with the firstborn, and such. But pregnant mother said no. You've just been covering our breastfeeding. How about us? How about the people who were just about to go and labor? So that is why that topic was not discussed for today. So let us know what you want us to talk about tomorrow, Wednesday. Talk to us, call us, and we can do this together. Once again, thank you so much. Tag a mom, share it, and share it. You are all amazing moms and daddies, and you're doing a very good job. And Mamatoto is your #1 fan. Never forget that. Thank you. God bless you.